everyone. My name is Katie Brumfield, and I am the Career Services Specialist at the Colorado School of Public Health. And today, for Coffee and Careers, we are talking with Kelsey Robinson. Kelsey graduated from the Colorado School of Public Health with her Master's in Public Health in Maternal and Child Health in December 2019. Hi, Kelsey.
Yeah. Hi, Katie. How are you?
I'm good. How are you?
Good, thanks.
It's good to see you.
Yeah, you too.
Yeah, Kelsey and I worked together quite a bit while she was a student, so it's fun to reconnect. I can't believe it's already been a year. It's since graduation.
I know. Well, most of it's been in this weird like time loop of COVID. So
Sure.
Yeah.
Kelsey, tell us, what is your current job title and where do you work? And then kind of like, what are your big responsibilities in your job?
Yeah. So my job title is SBIRT Program Coordinator. My subtitle, so to speak, is Project Implementation and Strategic Initiatives. And I work for Peer Assistance Services, which is a small nonprofit in Denver. I think it'd be a little helpful just to give some background on kind of what we do before getting into my job description, if people aren't familiar with it. But so the organization has two main programs, and one of those is the SBIRT in Colorado program. And so that's where I work. And SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And it's a prevention and early intervention practice that's used in healthcare settings to help providers identify and reduce substance use. And so we're grant funded through 3 different state departments to provide that training and technical assistance in SBIRT to healthcare providers across the state. And then we also have a big public awareness campaign that's really aimed at improving conversations and destigmatizing substance use and mental health. And we also do a lot in the education and advocacy space around substance use prevention and mental health promotion, and just destigmatization of substance use. So that's kind of some background that I think will make my job description make a little bit more sense. So since it is kind of a smaller program, there's just 6 of us. I think one of the really cool things about being at a small nonprofit is that you get an opportunity to learn and participate in almost every aspect of our work. So every day and every week is a little bit different. One of my main responsibilities is coordinating one of those 3 grant projects. So I do a lot of work recruiting clinics into that project, just communication between clinics, scheduling, planning, and whatnot. Also, work a lot with the data collection from clinics. So as they're working with our trainers to help implement SBIRT in their practice, they'll kind of send us back data on their patients and just how everything's going. And so I help to collect that and then work on putting together our quarterly reports for our contractor. We also, over the past 6 months, received a lot of work through the CARES Act, so the big COVID relief bill. And so that took a lot of my time in the second half of 2020. So I worked to write proposals for that work, participated in budget conversations, coordinated with our subcontractors, really helped to promote the work across the state. And then again, worked a lot on the reporting back to contractors after that project ended at the end of December. And so that's kind of, I guess, my programmatic work with the actual SBIRT training and TA. And then I also work a lot on our public awareness campaign. So there's another organization in New York that we partner with on this, and I work with them a lot on our marketing strategy. I've also given some presentations and hosted live webinars explaining our work in SBIRT and also giving an overview of that public awareness campaign. And then I think the last big bucket is in that advocacy piece that I mentioned. So we have a SBIRT advisory council that we lead along with the alcohol epidemiologist at CDPHE that's part of the Substance Abuse Trend and Response Task Force. And within that, I'm on the steering committee, and then I also co-chair the Adolescent SBIRT Work Group, which is cool because it kind of brings back that MCH perspective into my work. So that's a lot, but those are kind of the main aspects. And then there's always smaller projects that kind of come and go over the year.
Sounds like a lot of collaboration.
Yes, yeah, a ton of collaboration. It's I think been really cool being a part of some of the other work groups in the Substance Abuse Trend and Response Task Force as well. There's a lot of substance exposed newborns work groups that I represent, peer and the SBIRT in Colorado program on. And so again, it's been nice to like bring back that MCH perspective and also just like see what other organizations are doing across the state. So yeah, we definitely work with a lot of different groups who are doing some great things in substance use prevention and mental health promotion.
Yeah, that's amazing. How did you find this job?
To be honest, I think I just found it on LinkedIn. But as it turned out, one of, like as I was interviewing for it, one of the people who we work with a lot in those work groups actually was someone that I worked with at CDPHE at the time. So when I was doing my master's in public health, I also had a part-time job at CDPHE. And so I think that connection definitely helped a lot. It's kind of crazy how small the substance use prevention world is in Colorado. It kind of seems like everyone's interconnected in a way.
Yeah, that's very common in public health. Would you say your job search, so I guess your degree was in maternal and child health. Did you seek out only positions in substance prevention, or was that kind of just where it landed and you really enjoy it?
Yeah, I would say it was kind of where I landed. My undergraduate degree is in psychology, so I've always had an interest in mental health and substance use. But when I first started my master's, I was actually working as a behavior therapist, working with kiddos with autism spectrum disorder. And then a really interesting kind of intersection came up at CDPHE, and they were doing a project within the retail marijuana health monitoring program that also had to do with looking at the use of marijuana with people with autism. And so I was a really, I think, interesting intersection in a good way for me to kind of start to segue into that more public health, like programmatic focused work. And so I was doing both of those for a while. I was doing behavior therapy part-time and working at the state health department part-time, and then eventually transitioned like more full-time with the state health department. And knowing that I had that background in MCH, my manager at the time there got me involved working on the Healthy Youth campaign. So that was kind of more with the retail marijuana side, more in the substance use prevention focus. And so I think it just kind of, it started working with kiddos and then just like slowly kind of took this segue more and more into substance use prevention, but I really enjoyed it. And I think a lot of the experience that I gained there, it just kind of made sense in this role that I'm in now.
Yeah, that's great. How has COVID-19 impacted your job?
Yeah, it's thankfully for us, I don't think it has changed it too much. We're still able to provide all of our training and technical assistance just via Zoom right now, which of course is not ideal to not be able to actually be at the practices and working one-on-one with providers, but for what it is, it's worked okay for now. So we've still managed to do a lot of our trainings, and then we've actually had some, like I mentioned before, some cool opportunities come up through that COVID relief bill. So we ended up working with 2 companies through that, and they helped us, one, to build out like some new telehealth trainings for our program. So since a lot of our providers that we're working with now are of course doing like meeting their patients through telehealth, they helped us work on some online trainings that we could provide so that providers can do screening and brief intervention and just learn about best practices. So that was a cool addition that we weren't really doing before. And then we also ended up subcontracting with Health Management Associates, and they worked with a lot of the clinics that I was working with one-on-one to help build out some of their like electronic health registries, and just to kind of help with that like tracking and proactive outreach of patients who might not be coming in during COVID for whatever reason, if their doctor's office is closed, if they just don't feel comfortable coming in person. It was to help reach out to people who we think might be at higher risk for maybe developing a substance use disorder or escalating into more risky use, or who potentially was already struggling with some anxiety and depression, and we felt, you know, might need that extra outreach to them. So it was another like cool project that came out of some of the COVID funding that I don't think we probably would have done otherwise. So those are definitely two positives that came from COVID, but I think doing everything remote also has been a little bit of a bummer since we can't actually be with the providers right now.
Yeah. Well, that's amazing though. I know mental health is high priority right now.
Yeah, definitely.
How would you say the Colorado School of Public Health prepared you for your current job?
Yeah, so I guess thinking just about coursework, I know there's quite a few that stick out that have been kind of the most helpful. I think the first one that comes to mind is probably the research methods and evaluation course, which I believe was a CBHS course. But we do a lot of work evaluating our program and also evaluating the public awareness campaign that we have. And I actually just recently submitted a manuscript of a pilot project. They're studying the impact that had and whether or not it increased attitudes and behaviors and beliefs around substance use and increase people's confidence to have conversations around substance use. So that was a really cool opportunity. And I definitely think that having the research methods and evaluation background helped with that a lot. I think another one's probably health systems management and policy. I mean, we do some advocacy work, and we also just a lot of kind of program planning. And so being able to put together a white paper and put together a brief and put together a logic model has actually been very practical in my role right now. So I think that coursework has been pretty helpful in preparing too. And then also I think while I was a student, I tried to be pretty involved with like leadership roles on campus, which I think helped, honestly just helped networking too, but helped to see like what other people are doing in the field. And I also was part of the CPHA mentoring program. And so that was great just to get to know what people are doing and what kinds of jobs are out there. And I think my mentor really pushed me to have like a lot of informational interviews and kind of coffee breaks and stuff with different people who she thought I would be interested in a role similar to theirs. So that was, I think, another thing. And I think you might have connected me with that program. So I think that was really helpful too while I was a student.
Yeah, that program has been on pause during COVID, but I hope that it can get picked back up once we're back to normal-ish. What advice would you have for someone that's thinking about pursuing a career in public health?
Yeah, so I think one kind of similar to what I was mentioning before with just meeting with people in the field is probably one of the things that's been the most helpful for me. So I guess my advice would be to just put yourself out there. I think everyone I've ever met with has been really excited to share what they do day to day and to talk to young professionals and talk to students or prospective students. So it can feel a little awkward at first, just cold calling people to go get coffee with you, or I guess virtually now. But I think, yeah, just being willing to put yourself out there and to meet people and just talk about what they're doing was really helpful for me, because there are so many different things you can do in public health, and it's really hard to narrow it down and figure out like what exactly you can see yourself doing day to day. So I think that's one big thing that was helpful.
Yeah, I think sometimes, we get public health professionals get into it, and then like similar to your story where you it takes this little turn, but it's a good turn. And it ends up being, a great career path. So I think that's really exciting. One last question for all of our current students. Does your organization take practicum students?
We actually do not at the moment, unfortunately, but it might have to be something that we look into.
Maybe in the future.
Right.
Well, good to know. So, because it's always important to gain experience while you're a student. You said you had 2 part-time jobs while you were a student.
Yeah, I worked part-time as a behavior therapist. I also, for a little bit, worked at the office of OBGYN at the Med campus. And then worked part-time at CDPHE. So kind of 3, but never all 3 at the same time, thankfully.
I was gonna say, wow.
Yeah.
All right, Kelsey. Well, thank you so much for sharing your career path with us today. And stay in touch. I'm excited to see where your career goes.
Yeah, thank you, Katie.